Chapter 17, Mastication. Question 1. Which of the following muscles initiates elevation of the mandible? A. Masseter. B. Temporalis. C. Lateral pterygoid. D. Medial pterygoid. Correct answer is D. Medial pterygoid. Medial pterygoid is the first of the elevator muscles to exhibit contractile activity as the mouth closes. The masseter and temporalis begin to fire shortly after medial pterygoid. Lateral pterygoid is largely involved in mouth opening. Question 2. In Engel's class 2 div2 occlusion there is A. Excess overbite of the upper lateral incisors. B. Negative overjet of the upper central incisors. C. Excess overjet of the upper lateral incisors. D. Excess overjet of the upper central incisors. Correct answer is C. Excess overjet of the upper lateral incisors. Excess overjet is characteristic of a class 2 occlusion, whereas negative overjet indicates a class 3 occlusion. Remember that class 2 occlusions are subdivided into division I, where all four upper incisors show a marked overjet, and division 2 in which only the lateral incisors exhibit a prominent overjet. Question 3. The walls of the maxillary sinus or sinus is related to A. The floor of the orbit. B. The floor of the orbit and the upper posterior teeth. C. The floor of the orbit, the upper posterior teeth and the infratemporal fossa. D. The floor of the orbit, the upper posterior teeth, the infratemporal fossa and the hard palate. Correct answer is C. The floor of the orbit, the upper posterior teeth and the infratemporal fossa. The superior wall forms the orbital floor. The posterolateral wall forms part of the wall of the infratemporal fossa, and the floor is in close contact with the roots of the posterior maxillary teeth. The medial wall forms the lateral wall of the nasal cavity, and the hard palate is medial to this, so is not related to the maxillary sinus. Question 4. Which of the following paranasal sinuses open into the middle meatus? A. The anterior ethmoidal sinuses. B. The anterior ethmoidal and frontal sinuses. C. The anterior ethmoidal, frontal and maxillary sinuses. D. The anterior ethmoidal, frontal, maxillary and sphenoidal sinuses. Correct answer is C. The anterior ethmoidal, frontal and maxillary sinuses. All the paranasal air sinuses open into the middle meatus except the sphenoidal sinus, which opens into the sphenoethmoidal recess, and the posterior ethmoidal air cells, which open into the superior meatus. Question 5. The maxillary sinus A. is lined by stratified squamous epithelium. B. drains into the superior meatus of the nasal cavities. C. is innervated by branches of the maxillary division of the trigeminal nerve. D. receives its blood supply from the first part of the maxillary artery. Correct answer is C. is innervated by branches of the maxillary division of the trigeminal nerve. In common with the rest of the respiratory tract, the air sinuses are lined with respiratory mucosa. The maxillary sinus drains into the middle meatus and receives its blood supply from the third part of the maxillary artery by the superior alveolar arteries. The superior alveolar nerves innervate the sinus and the maxillary teeth, hence the referral of pain from one to the other structure during toothache or sinusitis. Question 6. A patient is most likely to experience pain due to infection of the ethmoidal air cells sinus. A. at the base of the skull. B. on the forehead. C. in the cheeks. D. between the eyes. Correct answer is D. between the eyes. Pain during sinusitis is often poorly localized. Sphenoidal pain is usually experienced at the base of the skull. Frontal sinus on the forehead, and maxillary sinusitis produces tenderness in the cheeks.